Joining us now to discuss the bill that sets out to enact President Trump's agenda is Guy Ciarrocchi, a Republican who is a former candidate for Congress, and he is now a columnist for Broad and Liberty. And Maria Quinones-Sanchez is a former Democratic member of Philadelphia City Council. Thanks to you both for being here. Sure. Great to have you both for this conversation. Guy, I'll start with you. There's a lot in this bill. What's the pitch for it? Why do Republicans believe it's good?
Well, it is a good bill, and it's important that it becomes law. I think first and foremost is that absent this bill, the largest tax increase in history happens. If we don't make the tax cuts that were part of the first administration permanent, every single American will have their taxes go up. And coming out of one of the worst economies with the highest inflation, the last thing that poor families, working families, farmers, small business, the last thing any of us need is a tax increase. So that alone is enough reason. But secondly, there are good things. The promises about border security are in the bill. The promises about helping with education. We have a great education tax plan here in Pennsylvania. People can donate. The viewers can donate. I donate. It's now going to be part of federal law. We'll encourage you to get a tax write-off for your federal taxes to donate to organizations like the Children's Scholarship Fund or Blocks to help families. At the end of the day, it makes sure taxes don't go up. It spends money on the things, the promises that the president made, and it's going to help people that truly need to be helped. Is it perfect? No. The next perfect bill they pass will be the first one in the history of the Republic. It's a good bill.
It's a cruel, these tax cuts on the backs of the most vulnerable constituencies that we're seeing after coming out of COVID, with finally cities like Philadelphia moving the numbers on poverty and children. It is a cruel. The way they're looking to fund this is very cruel, and it's going to impact Pennsylvania and hurt the economy in Pennsylvania, right? When you're going to take, when you look at the $900 billion that comes into Pennsylvania from the federal government, and then you're going to cut Medicaid, you have the governor talking about whether we can't backfill all of these things that we know are going to move Pennsylvania's economy. So, and the one good thing about this bill is we finally know the truth around Republicans. They are not fiscal conservatives. They are going to throw this $1 trillion debt situation. They can never claim that again.
I want to pick up one thing that you mentioned about whether the state can pick up some of the costs and backfill some of that, because that's something that Governor Shapiro has talked about in Pennsylvania, saying that Pennsylvania cannot do that. Are there other options? Do you think there are other options?
Well, again, let's start with the facts. This bill will spend more money on Medicaid next year than we do this year. It will spend more money next year than this year. For the people who deserve it.
That doesn't mean that people won't fall off of it,
that's the cost of living. That's the cost of managing. That's the cost of people being treated. It will, and we all know, millions of people.
Politicians talk about cuts, not the way families do.
Millions of people will lose Medicaid.
When you spend more money in 2026 than you did in 2025, most Americans think that's an increase, not a cut. The fact that you may have wanted it to grow faster doesn't make it a cut. And the only people who will, quote, lose it are either here illegally or are able-bodied single people. Anyone, no mom, no child is going to lose health care. No one with a severe disability is going to lose it. Not one single person.
We don't know how things are going to work. We don't know how the paperwork is going to work. We don't know how the...
That's what the bill says.
60%.
This is going back to a standard that Bill Clinton ran on this. It's what Democrats and Republicans both agreed on. It drifted under President Obama and President Biden into very different. This is simply resetting it back to what President Clinton said. Able-bodied people should work.
Costs, all the increases in costs. When you talk about every program increases in cost because they're costs to salaries, wages. When you look at all of that, there's a ripple effect. When you're going to cut people off of Medicaid, they go into emergency centers. We're in health and med city. Temple, CHOP, all those hospitals where CHOP, you have a large percentage of folks already being subsidized on Medicaid. 60% of our seniors in facilities have some form of Medicaid coverage, right? And now you're going to go scrutinize all of this, do work requirements for people who are disabled, Let
me ask you about the work requirements specifically, because we don't know how exactly all of this is going to be implemented and work, and there are a lot of questions about that. But in the work requirements specifically, what is wrong with the idea the concept of a work requirement.
So you have permanently disabled people in some cases that are on Medicaid, people who worked and were exploited in their current work. I look at people like my cousin who worked 30 years in a factory and his back is killed him. He had to retire at like 58, wait until he can get Medicaid. He cannot work. So now you're going to make all these requirements, let doctors determine whether he can go back to work, cannot go back to work. The amount of oversight necessary for this type of work. Look, Elon Musk left the administration because he couldn't get the cuts. There is not all the fraud there that we talk about. None of that has bared out. So this notion that people are standing in line, filling out fraudulent applications, those numbers have not bared out. All you're going to do is cut government and then ask for more oversight. And who gets stuck in the middle? States like Pennsylvania, who have vulnerable communities, who have a large number of seniors, are going to be forced, again, at hospital doors, right? Or in these nursing facilities, trying to figure out how we keep people alive. Because people will die.
A few facts. We will spend more money in 2026 than we're spending in 2025. That's indisputable. It may not be as much as you'd like. We're going to spend more. Second, every single child going to Children's Hospital, St. Christopher's Hospital, or your neighborhood hospital that's being covered now will be covered. Not one single child in America will lose it. Third, not one senior citizen in the United States of America who is in fact a citizen will lose their coverage. All of the focus is on illegal.
Are being taken away from. So these kids.
There's not one person's right in America that's taken away. But let's just stick to the facts. The numbers are we will spend more money. Every child will be covered. Every senior will be covered. Every family will be covered. The focus is on illegal citizens, and the focus is on those people who are able-bodied. To go back to the Bill Clinton standard, why was it a good standard in 1996 and it's a bad standard in 2025?
I never agreed with welfare reform. We saw welfare reform hurt America. We saw some of the crime initiatives of Clinton. We're all living that reality. It sounds good. The narrative sounds good. Everybody wants everybody to work hard. Everybody believes everyone should have access if they work and they earn things, right? And all of that sounds well. But the implementation, and particularly under this administration, it has shows what he says is not what he does. We've seen it in the immigration debate. We've seen it as he's gone to court around birthright issues. The fact of the matter, cities like Philadelphia and our border cities who find themselves needing, first of all, a lot of that undocumented workforce. You saw they moved back on the farming issue, right? It's like, we're not going to go to farms anymore. Who is going to do this work, and how do we keep our economy moving, especially in a state like Pennsylvania that counts on agriculture and for instance, just SNAP alone. The removal of SNAP into the economy is thousands of jobs. It's those supermarkets. It's all the things we're talking about.
So let me switch to the sort of the political impact of this. And you were talking about Philadelphia. The Medicaid population, those on Medicaid, it's
600,000 plus.
42%. It's a large percentage in the city of Philadelphia. It is not as big when you get to some of the suburban areas and other parts of Pennsylvania where you could see some of the midterm fights. So is this
hospital
something
closures? We
that
saw it in
you think
Crozier.
Is going to resonate when it comes to
We saw it in
midterms?
Crozier. We saw all the hospitals are struggling, right? And so there's going to be a ripple effect. You cannot be an EdMed city with the suburban counties and the collar counties that we have and not impact the healthcare. The numbers are already out there around what is the impact of whether you agree with the nonpartisan budget center for Mark Steer and some of the numbers that they've put around healthcare jobs, when you see the funding to medical research. Philadelphia was key in the COVID relief on research.
Okay.
We're going to spend more money in 2026 than we're spending in 2025, and even more money in 2027. The fact that it's not going to grow as fast as some people would like is not a cut. It's not how any American defines a cut in their day-to-day lives. Every child in America in need will be cared for. Every senior citizen in America will be cared for. Every family in America will be cared for. We're talking about those here that are undocumented, that are illegal, and we're talking about those folks who are able to work. And the suggestion that we can't come up with a system to determine who's able-bodied and not, and because it might be hard or it might be challenging, we shouldn't do it. How much more money do you want to take out of people's paychecks? How much further in debt do you want us to go? Because it's hard to determine who's able-bodied and who's not. We need to have some oversight. We just can't keep spending trillions of dollars and say we'll figure it out later, or it's hard to figure it out. It may be hard. It is necessary financially. It is necessary morally. We shouldn't take $1 of anybody's paycheck for taxes and have it wasted or abused. People in need will be covered. Both parties agree on that. Why can't we build off of that and solve the budget crisis?
You're going to give tax breaks to folks in the top 1%, and then you're going to do that on the backs of the middle class community. Everybody's expenses go up. This notion, just because we're going to spend more, you spend more every month. That's part of what's going on in the economy. That's inflation. That's
For the
your
last 4 years,
insurance.
we've all spent a lot more because of the Biden policies.
So when you say we're spending more money because we're caring for people and the economy continues to change and it is in flux. We still don't know what the tariff situation is going to be. We're one of the states with the largest number of federal employees. Those federal employees are still getting paid. What happens to public perception and the economy in November, December when those folks, payments go out and they enter unemployment rolls in the state of Pennsylvania?
Let me take us away from the healthcare for a moment and talk about something else that's in the bill that has popped up in Pennsylvania as well. Because in this bill, we also have no taxes on tips and no taxes on overtime. That's popped up in Harrisburg, proposed by a Democrat as well. So with that on the federal level and it being proposed by a Democrat on the state level, what does that tell you about that policy, and where do you think we go from here on that?
So I think that, again, it's promises made, promises kept. This budget is a reflection of that. This border policy is a reflection on that. And now the no tax on tips, no tax on overtime. It's also a recognition that working families and young people working and struggling to get ahead that have a second job, this is an attempt to say we're going to try and keep more money in your pocket. Because at the end of the day, what we should want is not a bigger federal government that does more and more for us, is that people keep more money of their own so that they can afford their first house or their first car. This is an attempt to do that. And the fact that the Democrats are buying into it,
that's
good.
We
this is a good.
We can't get an increase on the minimum wage. This is all about the fact that we don't want to give an increase in the minimum wage. We're going to make people.
Why can't we cut taxes?
We're going to benefit people.
Well, but the cost of it in the measure. I mean, again, this is just a talking point that the impact of that is so minimal compared to when you look at the tax breaks of that top 1%. I mean, those folks are entitled to it. If you're a tip staff and you're still getting $285 because we can't bring up the minimum wage, of course people are going to look at how do we take care of low wage
so why don't we celebrate
owners.
There's something that both parties agree on and make it part of the law and take it out of debate fighting?
The cost analysis on that is so minimal compared to what the tax increase. No, we should be taking care of low workers by giving them a raise in the minimum wage and the tip staff. If you pay people quality salaries, family-sustaining salaries, we wouldn't be coming up with all these other ways to tax with uniformity. Almost no one in the Delaware Valley makes minimum wage. Almost nobody in the Delaware Valley, and no family makes minimum wage. The tax on tips and the tax on overtime is a reflection that there are people who go out there and bust their backs to go out and work, and it's to let them keep more of their money. That's what we should all be in favor of. How can more people keep more of the money that they earn so that they can take care of themselves? The objective is not to grow the number of people getting checks from the federal government. It's to reduce the number of people because they can take care of themselves.
We're going to have to leave. We're going to have to leave this part of the conversation there. More to come on this. Thanks to you both. Guy Ciarrocchi and Maria Quinones-Sanchez, thanks so much.
Thank you.